Hello, my name is Madisyn Travis, and today I will be talking about Syria's inability to provide healthcare and healthcare delivery to their citizens during the coronavirus and amidst the war. So, as we know, 2020 was a very devastating year as far for global health, and as the coronavirus raced through the world and became one of the top killers, it became a catalyst for insufficient healthcare around the world. And so, especially in Syria, it played a very large role in deteriorating their healthcare delivery and their ability to give access to their citizens. And so, also the war that they just had got out of didn't really help. Also, as 70% of the healthcare workers fled the country following the war. So that meant that many public hospitals didn't have enough medicine, healthcare workers, and hospitals also got destroyed during the war as it became a target for other allies, and it was mostly destroyed during airstrikes. And so, as it's very common for citizens of Syria to die from wounds and non-life-threatening diseases, it's just known that Syria is not equipped to deal with the pandemic. And so, I feel like this case is important because it highlights an area of the world that is struggling to give adequate health care to their citizens. And my political challenge is linked to health because it illuminates the lives of those who have to fear for their life and having no reliable health care. And I feel that my case can be explored on the global and the international level. And so Syria is not the only country who has had to deal with the cracked system of healthcare, as Afghanistan is also a very good example, as they both became deteriorated after a civil war, and citizens of both of these countries often have to travel far distances in order to get adequate health care. And like neighboring countries such as Turkey or Iran, and for Afghanistan, they will often travel to India or Pakistan. And um, there haven't been a lot of initiatives to stop the outbreak of the coronavirus. One by Syria has been to implement work stoppages, but as it may seem like a good idea in the beginning, it turns out to be very bad because many Syrians rely on labor to put food on their table. And not only has the economy slowed down, but if Syrians are not able to put food on their table, this also leads to deterioration in an insurmountable amount of Syrians' health. And my case is linked to justice, inequality, and development because it's linked to justice because Syrians need the Syrians deserve the justice to get their fundamental human right, which is good access to medical health care, to ensure a long and healthy life. And it's also linked to inequality because like in a specific area, um compared to other counterparts of the world that have not been affected by war, such as the United States and the United Kingdom, they're able to give their citizens medical treatment during the pandemic. And I feel that since there's such a large lack of resources to help sustain the lives of those who live in Syria, it's just not fair. And finally, this is linked to development because um consistent efforts need to be made, and the healthcare system and healthcare delivery of Syria needs to be developed before it creates chaos. And this improvement needs to be in the public health sector, as I said before. And I feel like only prompt, coordinated efforts and proactive solutions are the only way to mitigate the negative and serious effects of coronavirus. And one theory that I found that this can be associated with is universalism. Okay, so before I get into why it's linked to universalism, I think I want to talk about the definition of what universalism is. And so universalism is the theory that one certain idea can be applied, it's applicable to society. And so the one theory that I have is that everyone should have access to adequate, affordable healthcare. And so you cannot say that this is not applicable to the universe, because there isn't anyone or any population that should not have access to good healthcare. And so the equal playing field between countries is a must. And one of the conflicts of interest in that is stopping Syria from getting the adequate healthcare they need is the Assad regime, and it links to the core areas of sovereignty and power, because their regime has really undermined and failed to prioritize the interests concerning public health. And so many decisions have been made by the Assad regime, such as not stopping flights from Iran into the country. Also, throughout, according to the World Health Organization, um, Syria did not conduct any coronavirus tests throughout the entire month of February. And this really negatively affects the Syrians, because if no one's receiving tests, how will people know who's being affected by coronavirus? And the regime has also, throughout a couple of months, denied citizens from receiving COVID tests or receiving the proper medical attention that they need if they're suspecting that they have coronavirus. And as I said before, there's a lack of, I feel like this is a lack of competence by the Assad regime, because had they really known like what the effects of coronavirus are and how they can affect their citizens, I feel as though there could have been a shift in perspective. And also, citizens of Syria are not being notified of their relatives um suspecting symptoms of COVID. So these family members continue to stay around their relatives who have coronavirus symptoms or are suspected to have coronavirus. And since, like I said before, they're not able to get tested, like no one knows. So like nobody's on the same page in Syria. And I feel, like I said before, I feel like someone really needs to step in and pull it together and come up with proactive solutions, and maybe make an effort to educate Assad's regime, since they're so powerful and they don't do anything but show patriarchy and undermine the concerns of the Syrians' health. And so, since there's also no adequate accessibility to medical equipment, ambulances, and public hospitals, I feel as though maybe the World Health Organization should step in and bring in volunteers from different countries, since 70% um of the medical healthcare workers have left Syria. And also, the regime and other allies have killed over 840 medical personnel. So not only is there a depletion of the hospitals and the equipment needed, medical healthcare workers are at risk when they're entering Syria through airstrike, and it has also destroyed critical infrastructure there. And so, due to the lack of precautions that are being taken by Syria, since the government isn't implementing any serious precautions, the World Health Organization estimates that 2,413 people will be infected with the coronavirus among 4 million people of the northwest Syria. And while this may not seem like a very big number now, it will continue to grow, and people will end up becoming affected by the coronavirus. And so, I feel as though that the devastation of their health sector being destroyed by the airstrikes, Assad's regime, constantly failing to prioritize the well-being and the health of their citizens, it shows that the ultimate goal is to control and weaken its opponents, like not valuing their, even at the expense of like the health of Syrians. And while it may seem easy to contain the virus, it shows that it cannot be easily contained here. And while Syrians will have to pay a heavy price following the corruption of the government, it shows that health is a very hard concept, and through coordinated efforts, it can be defeated.